everyone, I'm Haley. I'm a first-year family medicine resident, and in this video I want to talk about how I prepared for COMLEX Level 3. So first off, I just want to say that I passed, so I'm so excited. I am done with my board exams until I have to take my family medicine boards, of course, but I have taken my third and final COMLEX exam, so I am thrilled, and I passed. So I'm going to tell you how I prepared and studied for COMLEX Level 3 as an intern. First, I do want to say this video is sponsored by TrueLearn. They are a question bank. They have tons of questions. I use them for COMLEX 1, 2, and now 3 to prepare for a lot of the OMM portions of the exams, so I definitely recommend them. I will be talking a little bit more about them later in this video as well. So first off, intern year, which is your first year of residency, is so busy and just hard. You're transitioning from being a med student to practicing physician. You're just learning all the ins and outs of like the hospital, the clinics. It's just a lot, and so finding that time to study and prepare for Step 3 or COMLEX 3 is very difficult. It's not how it was in med school when I mean, our school had a built-in curriculum where we had time to study and prepare for these exams, and you don't get that in residency. So it was really hard to find that time. I think one of my biggest recommendations would be to start studying as soon as you can. The sooner you get it done with, the easier your life will be, I think, as an intern, because you're not having to like find that time to study later. I took COMLEX in March of this year. I started studying in January of this year, so I had a couple of months of studying. I feel like that was enough time to prepare for the exam, especially since I wasn't able to study every day. I was exhausted. Just having that, like trying to find that time in between working and managing patients is hard. And so you just fit in the studying wherever you can. But that being said, I also feel like I probably didn't need to study that long. So keep that in mind. I started studying in January of this year. I was on my labor and delivery, my OB month, which is just, they were long days, and so finding time to study on that rotation was really hard. My goal for studying was getting like 20 to 30 questions done a day, and I don't think I did that at all during that first month. I was lucky if I did 10 questions a day. Sometimes on the weekends, if I wasn't working or didn't have anything going on, I was able to do more questions, which is good. You kind of find that time when you can and you just study. But I did take some PTO, which is paid time off, so some of my vacation days, because I was not going to let them go to waste. I was going to use them either for a day off or just to study, and so that's what I did. It was pretty helpful to have some study days here and there and like have some long weekends where I was able to prepare for the exam. I saved a lot of the OMM questions for last, just because that was something I hadn't seen all of intern year, because I'm not at a DO specific program, so I'm not actively practicing those things. I saved the OMM questions for last, like the 2 weeks before my exam. I did read the Green Book again. I have read it for every COMLEX exam, and I think it's such a good quick review. It's not a hard book to read. It's short, it's small, it's concise, and they have a lot of good mnemonics to remember things, and so I recommend reading the Green Book again. It's just very helpful for me personally, so I think maybe other people might find it helpful. So now we'll talk about TrueLearn. So TrueLearn is an excellent question bank in my opinion for DO schools and for OMM. I use TrueLearn for COMLEX 1, 2, and 3 for the OMM portion of all my exams, and their question banks, I don't know if it's just an update for COMLEX Level 3 or if all the other question banks have it for 1 and 2. They didn't have this when I took 1 and 2 with them, like use their question bank for 1 and 2, but they have OMM videos. And so those were actually very helpful because I haven't seen a ton of the OMM manipulations. And so just being able to visualize them and work through them, I'm sure if you take COMLEX, you know how to do that during the exam, but it was just very helpful to have those videos. They also have a ton of practice questions. I think they have over 2,000. Their explanations are actually very helpful, and they'll have links that you can click that will take you to either a video or like a helpful website or page or anything. So I really liked that. I thought I didn't buy any of the practice exams through the NBOME. I used what TrueLearn offered, which was like a 200 question exam. I did that, and that was actually very helpful. Yeah, let me show you a little bit about TrueLearn. So this is the TrueLearn app on my iPhone. I used it frequently while I was studying because it was the most easily accessible. While I was on my rotations, you can change the number of questions you want, the test type if you want new or incorrect questions, and you can also change your category pretty easily. So we'll go through this one. I'm not going to read it or actually answer it, but I want to show you the feature that you can pause it on the app, which is very nice while you're running around in the hospital. And I'll take you to the dashboard. Don't judge me, but this is just what it looks like on the app. Again, very helpful and very easy to navigate. So I really liked using TrueLearn's app. Guys, thank you so much for watching my YouTube video. Like and subscribe to my channel, and then make sure you click the link for TrueLearn discount. If you have any questions, let me know in the comments below. Thank you. Bye.